Hello friends, welcome back one more time on my YouTube channel, Dr.Nilesh Advice. I wish you all must be fit, fine, happy, healthy and hearty. Speed up. Today's topic is speed up. Why the newborns or the infant do the speed up? What is speed up? Speed up means removing some of the food which they have taken. Mainly the breast milk or the formula feed which they have taken, they bring it out or they do the vomit, that is known as spit up. So why the newborn or the infant has the more spit up, that we will going to discuss today in this video. And what are the things you can do at home, what the mothers can do at home, that we will discuss in this video. Is it normal that the children do spit ups, or you have to go to the hospital, you have to consult a doctor? That we will discuss. And what is happy spitters, and when it is a concern that you have to go to the hospital, that also we will discuss. Is any treatment required, like any medications required for this, that also we will discuss. So today we will discuss most of the things related to the spit up in the newborn or the infants. The vomiting in the older children are the different things. It can be because of the infections. Many reasons are there for the vomiting in the older children. But today what we are going to discuss is mainly related to the newborns or the infants spit ups, or you can say like the regurgitations or the reflux, gastroesophageal reflux. Those are the things which we will discuss today in this video. Before I start the video, I want to say that I have already one channel which is in the Gujarati language. So if there are any parents who understands Gujarati and if they want to follow me in Gujarati, they can watch my channel known as Gujju Baby Care. So that is a new channel, and I have just started posting some videos on that channel as well. So one channel in English, this is the Dr. Nilesh Advice, where I am talking the baby related problem, baby's health related problem in English, and one other one in the Gujarati known as a Gujju Baby Care. And again, I want to emphasize that this channel is not for any profit. There is nothing like the commercialized activity, nothing for to earn money or something. So the pure intention is to help the parents, to give the information which is useful for the parents to bring up their child and to make them healthy and lively and the good human beings in the future. Okay, so we will not waste more time. We will start our video on the spit ups. Friends, spit ups. You might have seen that all the newborn which are born have the some or other time the spit ups. Many times some of the milk which they have fed, that will come out through their mouth, sometime to the nose. If the content increases, it will come out from the nose. So many times what happened, that child has fed, the either the breastfeeding or the formula feeding was given, within half an hour or 1 hour the child will bring out some of the milk. Sometime it is same to same as consistency of the milk, it will come out. Sometime it is like some digested milk, like the curd kind of the situation, curd kind of the things which will come out from the mouth. Sometimes the baby does lot of efforts and it will come out. Sometimes baby doesn't do the efforts and it will come out. And these are known as the spit ups or the reflux or the regurgitations. That milk will come out and we will see it as a reflux, or we will see it as a vomitus. So generally, as per the literatures also, like the newborn who they might have around 15 to 20 spit ups in a day. It is not actually the spit ups, but it is actually the milk which comes through the mouth and again it will go back. But some of them will come out through the mouth, that we will see as a vomitus. So around 20 regurgitations, and some of them will come out in from the mouth Those are the common things. Generally, on an average, first 2 to 3 months of the age, the children or the newborns have around 3 to 4 vomiting. They do the feed, they take the breastfeeding well, they pass the urine well, they are happy, alert, active. They don't show any signs of discomfort. Still, they have the some or other vomiting or the spit ups. So these children are known as a happy spitters. Means they don't have anything, but they just spit 3 to 4 times in a day. That is known as a happy spitters. And happy spitters are the normal thing. It is known as a physiological thing. That is a normal to the child, and most of the children have the 3 or 4 vomiting or the spit ups in a day. We will consider it as a normal. Now, why this spit up happens in the newborns, or why this spit up happen in the infant? I will do this demonstration on this one of the toy which I have. You might have seen our hero in many of the videos. So basically, what happened that this is our nose and the mouth. From here our food pipe starts. So this is the mouth, the child will take a feed, food pipe here, and here we have the stomach. So between the food pipe and the stomach there is a one valve, gastroesophageal valve. So in between these two there is a one valve. As we grow, that valve becomes so strong that it will completely get closed. So whatever food we ate, it will go into the stomach, and this valve will be get closed, so that the food which went into the stomach will not come up. But in the newborn or the infant, this valve is either partially open, or it is not completely getting closed, or sometimes it is not that much functional, so that some of the milk will come up. It will come up to the mouth sometime, it will go back, or it may be, if it is came with the more force, maybe something will come out to the mouth. If the quantity is more, it will come out from the nose as well. So this is basically the reflux. So the child has taken the feed, it went to the stomach. If the valve is getting closed properly, the milk will not come out. But if it has not closed, then some of the milk will come out. So some of the time it will come out to the mouth, some of the time it will not come out to the mouth, and the child will again swallow that milk. So that is the mechanism that how the child develop the spit ups or the reflux, or it is known as gastroesophageal reflux in our terminology. Gastro means the stomach, esophageal means the esophagus. The esophagus means the food pipe. The food pipe, stomach, gastroesophageal reflux. Now, then whether it is serious, like we have to go every time to the doctor if the child vomit is out like this 3 to 4 times in a day, you cannot go, and it is not advisable also to go to the doctor. So when you have to go to the doctor, or when you are more concerned that these spit ups are not usual, or these spit ups are related to some of the illnesses. Now understand one thing, the spit ups generally are the milk or the gastric juice, means the digested food particle which are mixed with our digestive enzymes. Our body, our stomach secretes lot of amount of the chemicals, enzyme, which digest that milk. So whenever child is vomiting milk and the digestive enzymes, digestive product which will look like more of the sticky thick material, looks like the curd, then this is considered as a normal. But suppose color is green color, and which green? You can see in my background there is a one frog which is the green color, or maybe you can see the leaf, those are the green color. If any content which is coming out of the green color, or there is a blood, means the red color, that is the indication that you have to go to the hospital immediately without any second thought. Green color vomitus indicates that there is something serious inside your intestine system. So whenever any baby has the green color vomiting, it's immediate indication to go to the hospital. Blood colored vomiting, obviously everybody knows that it is an emergency, that you have to go to the hospital and consult the doctor as early as possible. So if the baby is passing green color vomiting or the red color vomiting, immediately go. Second thing, child is much more in the discomfort. If the child vomits out, still child is not in the comfort zone. Child is getting more irritable, excessive crying. While child is taking feeding, at that time also he is more disturbed. Yes, you have to meet the doctor. Now the important relation of the spit ups is the related to the weight. If the child is gaining the weight or not, that is very important. Suppose one newborn who is doing vomiting multiple times in a day and he is not gaining the weight, that is the indication that you have to meet the doctor. On an average, in the first 10 days of birth, child lose the weight, because when the baby was inside the womb, child was under the water, so body is filled with the water. As the child will come out, that water evaporates. So around 8 to 10% of the weight loss in first 10 days is common. After that, child will start gaining consistently weight. If the baby is spitting up multiple times, discomfort and not gaining weight, there might be some issue. There might be some problem which needs to be get addressed. So your neonatologist or the pediatrician will help that what is to be done in that situation. Now, if the spit ups are more, if the content is greenish color, reddish color, child is not gaining weight, child is in the discomfort, child is not passing adequate urine, or child has other issues like child having the faster breathing, child has consistently cough, yes, these are the indications. Then you have to go to the hospital and meet that what is the problem, is the child really need any treatment. Now suppose neither of those features are there and child is just doing 1 or 2 spit ups, but yes, we are still worried, because many times child might have the more spit ups and the problem is more. So in that case, what you have to do, rather than that, it should be the habit to do the burping to the baby, so that this spit ups will reduce over a time. So on an average, this spit ups will drastically reduce by 5 to 6 months of age, because at that time child will start sitting, and almost negligible by 1 year of age, and it will be completely get stopped by around 1.5 year of age. So what you can do at home to reduce the spit ups? So the most important thing is to do the proper burping, at least 15 to 20 minutes in the vertical position after the feeding. Second thing, many children who are on the formula feed, if they are getting too much feed at a time, then this spit up will increase. Many times the parents keep the time wise schedule. Now 2 hours passed, let's feed. 2 hours pass, let's feed. So if you will follow the time based schedule, then obviously the baby's spit up will increase, because baby has not emptied his previous meal. So frequent feeding or the overfeeding also causes the increase the spit ups. And how will you know that it is because of the overfeeding? By just checking the weight. If the child is gaining more weight than the usual, then it must be the overfeeding. Now the technique of the burping is also important, and everybody knows how to do the burping to the child. Still I will demonstrate on our baby, our toy. So this is the baby. Once you have given the feeding, first of all you will make him little comfortable. Hold the baby's body and the neck in the same plane, so that baby's neck will not fall. Hold like this. You can hold like this with the your palm and supporting the neck, and keep over the shoulder like this. Keep over the shoulder like this. But make sure that baby's stomach should not be directly on your shoulder. Rather, the baby's chest should be on your shoulder. You hold the neck and the head Okay, you support them, that neck should not be unsupported. Okay, and take care that baby's nose also should be open. Many times when you keep like this, baby's nose is getting blocked, so you do little up, let the baby rest like this, and you can do the tapping or the dabbing over the baby's back, and keep in this position for at least around 15 to 20 minutes after each feeding. So this will help the baby to reduce these spit ups. By doing this kind of maneuver or the burping, another one important problem we will solve, that is the colic pain of the babies. Because what happened that when the child take the feed, the child has to develop the negative suction to take the feed. So whenever child is taking the feed, the milk also goes and the air also goes. So it keeps on sucking, so milk will go, air will go. Now once the air will go inside the intestine, some of the air might come by doing the just rumination sound or the burping sound by the baby, but significant amount of the air still stays in the baby's intestine, and this air will keeps on moving inside, which is causing the discomfort that is known as a colic pain of the children. So this keeping the baby over the shoulder, this will help to remove the excess air which child has taken, so that will help to reduce the colic pain also. There are various other ways you can do the burping. This is one of the easiest and maybe the adapted by almost all of the parents, just to keeping over the baby over the shoulder and do the tapping. And anybody can do, father, mother, grandparents, anybody can do this type of the tapping for the babies. So what we have discussed so far is spit ups, or the children who are the happy spitters, who just keeps on spitting the 3-4 spit ups in a day. That is absolutely normal. That is not a sign of abnormal spit ups. But if the child is doing the green color vomiting or the red color vomiting, child is losing weight, child is in the discomfort, obviously you need to consult the doctor. How you can reduce or prevent the spit ups by doing the proper burping. And many times the spit ups is more in some of the children, they are really happy spitters, but they do the more spit ups. So there what you can do, you can prepare the smaller meal, and maybe you can do little bit frequently. So like this is not like the overfeeding what I have discussed before. Overfeeding means every time you will give more and more feeding, but instead of that you will prepare the smaller feed and give it frequently, so that will effectively reduce the spit up of the children. So I hope I have given the useful information about the spit up, and almost everything I have discussed, what is the happy spitters and when to go to the hospital, burping style, how to do the proper burping to the baby. If you find this information is useful, then you can like this video and you can share this video with your family, friends, colleagues, so that they also get acknowledged about the spit up in the children and how to deal with it. Thank you very much. Bye bye.